adverse drug events remain major sources of patient harm. To help ensure patient safety, Thomas Jefferson University hospitals embarked on a multi-pronged journey to reduce harm from medications. Their goal? To decrease the number of medication events that required patient intervention and to increase the time between harmful medication errors. Jefferson implemented numerous process improvements and safeguards for high-risk drugs relating to chemotherapy, pediatrics, insulin, anticoagulants, and opiates. Technology has been leveraged to help ensure medication safety. Jefferson also wanted to foster a culture that supports transparency. The pharmacy department began by implementing a medication events agenda into their monthly staff meeting. Leading off by crediting individuals with good catches, the forum segues into a discussion of any medication events that involve the pharmacy, either directly or indirectly. Dialogue is encouraged, and the session ends with useful suggestions to prevent future events. Medication safety is also a set item at the monthly Pharmacy Nursing Committee meetings. And to further nurture transparency, the Medication Safety Coordinator prepares and distributes to all staff involved in the medication use process an electronic bi-monthly article that provides event report summaries. Jefferson also began a recognition program that encourages staff to acknowledge colleagues for any safety efforts. Due to the organization's 5-year initiative, serious medication events have dramatically decreased. And as of August 2014, Jefferson was 180+ days without a harmful medication event. For their work to build and sustain a safe environment for their patients, we are proud to name Thomas Jefferson University Hospitals as the third-place recipient of the 2014 Delaware Valley Patient Safety and Quality Award. Hospital units are dynamic environments. Their care providers must communicate and coordinate efforts to ensure high-quality patient care. Since face-to-face conversation is a challenge, providers usually rely on intercoms, landline phones, and pagers to stay in contact. The Hospital of the University of Pennsylvania recognized that these methods were disrupting workflow. Providers spent considerable time identifying other care team providers, limiting time for personal interaction, and messages were not easily prioritized in terms of urgency. To improve team communication, the Hospital of the University of Pennsylvania spearheaded a pilot that uses smart technology. Nurses, residents, faculty, pharmacists, and social workers were provided iPhones or iTouches. The providers then utilized a secured messaging application, Curator, for all non-urgent communication, such as discharges, patient questions, and medication order changes. Throughout the program, the Hospital of the University of Pennsylvania senior staff conducted leadership rounds, gathering input about the tool to troubleshoot any issues. The results from the pilot were remarkable. Nurses reported that they saved 60 minutes daily, and physicians said they saved 90 minutes. And both nurses and physicians felt the more modern technology improved the efficiency of patient care. The higher productivity led to decreased length of stay for patients, as well as improved discharge time on some units. And, best of all, since communication between team members requires less time, more time can be spent on conversations with patients. For their charge to improve communication and workflow efficiency among providers, we are thrilled to recognize the Hospital of the University of Pennsylvania as the second-place recipient of the 2014 Delaware Valley Patient Safety and Quality Award. In 2013, Mainline Health System committed to reducing preventable mortality. To drive improvement, they established a multi-campus, multidisciplinary team. Ensuring system-wide commitment, they developed a standardized review process. It utilized an updated mortality database, stronger summary reports, and a required physician review. Campus mortality committees were also on hand so that work and mission were aligned. Another step was to improve management of sepsis, the #1 clinical reason for preventable mortality. Mainline formed a nurse-driven protocol with a sepsis alert. The system informs the ICU and support staff that a severe sepsis patient is being treated in the emergency department. Because this model has been so successful, it has been transitioned to inpatient settings. Mainline also partnered with Siemens to integrate an early sepsis warning system into electronic medical records. The organization further improved its clinical documentation by engaging clinical documentation improvement specialists to review medical records and support physicians. And, recognizing the need to expand their palliative care services, Mainline began a palliative care internship program. Palliative care and hospice nurses are now at each campus, so patients at the end of life have caregivers focused on their needs. Due to Mainline's efforts throughout its 4 hospitals, overall mortality decreased by 39%, and sepsis-related deaths were reduced by 55%. What's more, the staff's increased focus on personal accountability has raised the bar on Mainline Health's mission of providing superior patient care. For their commitment to positive change and a healthy culture, we are honored to recognize Mainline Health System as the first-place recipient of the 2014 Delaware Valley Patient Safety and Quality Award.